Hello, Dr. John Dahlman, chiropractor, and I just had a patient who has a lumbar disc problem. And when we talk about lumbar disc problems, we have a lot of different terminology that we use. Some are we use a herniated disc, some use a bulging disc, some use the term a slip disc. And I thought I'd make a little video to show you what the disc is and exactly what happens when you have a disc issue. So I'm going to use some models here. All right, this is our sequence that we have for textbook normal. You'll see the disc space, the vertebrae, the disc space. When you look down from the top, and you look at this middle portion, this is called the nucleus. And these fibers that go around the outside, these are called annular fibers. Those annular fibers are hard cartilage fibers, and they can tear. And when they tear, the nucleus material can ooze into the disc space. Now, another example over here, this shows a tear in the annular fibers of the disc, and it shows the nucleus, which is kind of a gelatinous or jelly type substance. It shows it oozing out into, and it creates this bulging effect. Now, there are nerve fibers in the annular portion of the disc. So just the tear and this jelly material oozing into that can irritate the nerves and be extremely painful. We call that discogenic pain. When we look at the bulge itself from the top, we can see on this spot, see, this is where the nerve root comes out, and here is a bulging disc, and that is called a herniation. Now, a herniation gets outside of the annular fibers here. So the material actually breaks through and it herniates into this space. And it creates pressure onto the nerve that exits. The nerve should be big and healthy like this nerve, and it compresses the nerve, and it's extremely painful. So when people talk about, I have a slip disc, you can have many different variations of it. You can have just a tear, like we talked about. You can have a tear where that material oozes into the tear, and then you can have a bulge, which is like right here, where it hasn't completely exited the annular fibers, or you can have a herniation, and that's where this nucleus material gets into the hole where the nerve root comes out. Sometimes the disc can bulge directly back into the spinal cord. And then you can have pain on the right side, you can have pain on the left side, or you can have pain on both sides at the same time. There you are. I hope that helps explain it so that you can get a better visual aid to see what happens when you're having disc problems. Chiropractors treat disc problems every day, and I hope that helps. Thank you.